Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the weekly COVID pandemic update with data accurate through May 5th, 2022. This week, because our numbers are down, I'm going to go back to something that I did about a year ago, and that is to try to summarize the pandemic in 3 minutes. So just give you a quick update on what's going on. This doesn't mean that I can't answer your questions offline, or of course, if things start to get worse again, which they may well, I'll go back to doing a longer update. But at this point, I think people are mostly interested in what's going on. Are we seeing a resurgence and so on? So globally, what we're seeing is this continued slow decline in the number of deaths. And that's very reassuring. In fact, at this point, it's less daily deaths than we've seen at any point since March of 2020, when the pandemic really started to take off globally. Now, officially, there's 6.2 million deaths worldwide and about 2,000 deaths a day. So still, we're not talking about being out of the woods, but certainly better than we have been at many times. Now, some of you may have seen a news report this week from the World Health Organization. They're saying that they think the total number of excess deaths, both directly due to COVID and indirectly, because people weren't getting health care or some other reason, is probably closer to 15 million. And this is consistent with what we've talked about before in terms of excess deaths. But just to give you a sense of how impressive this pandemic, unfortunately, has been. In terms of the United States, after that Omicron surge you see there on the right, we are seeing this slow uptick in the number of cases. And of course, no one can tell you right now what that's going to do, but it's well below what we've seen in most of the previous spikes. In terms of hospitalizations, we're also seeing a slow uptick, even though it's lower than it has been at any point since last summer. Fortunately, in terms of deaths, we're not seeing the uptick yet. Of course, we wouldn't necessarily expect it. We might expect it to be 2 to 3 weeks after hospitalizations went up, but the numbers are very low. And as you can see, just a few deaths a day more than we saw at the lowest point last summer. Having said that, of course, the obvious point is that this is a pandemic that has gone up and down. It's actually been lower than it is right now, and it came roaring back. I'm not saying that's what's going to happen, but we certainly have to keep our eye on it. So over 1 million deaths in our country and running about 500 deaths a day. A week ago, this is where the cases were, largely up in the upper Northeast. This week, it's changed slightly. I'm just going to go back and forth between last week and this week. And what you can see is it appears to be getting a little bit darker in the Northeast, but also in the upper, in the Michigan, Wisconsin, Minnesota area, and perhaps a little bit out west as well. Now, historically, the two main spikes that we've seen, one sort of started in the urban areas and came down. The other started in Florida and came up. So I don't know if this is really a new pattern or not, but certainly something we want to keep our eye on. So globally and in the United States, deaths are not going back up yet. We are seeing an increase in cases and an increase in hospitalizations. So that's a quick 3-minute update on the pandemic. As I said in the beginning, I'm happy to answer any questions offline. I actually enjoy getting your emails. I will be traveling the next couple of weeks and maybe a little delayed in answering them, but I do look forward to hearing from you. In the meantime, there's a lot of other information about COVID-19 on our website. If you are sharing these videos with someone, which I hope you will, if they want to be added to the mailing list, we're happy to do that. As always, I'd like to thank Dara Young for editing, producing, and posting this video. And as I say, if you have any questions about what I've said this week or about COVID more generally, please let me know. I look forward to hearing from you. Until next week, please be well.